Headaches and neck pain localized to the suboccipital region is often due to muscle tightness of the upper cervical muscles where they attach to the skull. Discomfort in this region can radiate to the top and sides of the head as well as toward the ears. A few simple exercises can be performed at home that may help alleviate this discomfort. So the first thing we're going to do is we're going to stretch our neck. And we can do this by simply sitting or standing up nice and tall. And we're going to take our chin and tuck it in. And as we do, we're going to look down. So what you want to feel is you want to feel this kind of lift up from the back as you look down whilst tucking in your chin. You can even leave your finger here. So tuck that chin in, look down, and feel that nice stretch in the back of the neck. I'll go ahead and turn to the side so you can see what that looks like. I'm going to hold that stretch for a few deep breaths. You're going to feel the back lift a little bit as you're tucking, and just hold it as you breathe in. Everything should be relaxed and gentle. And again, you can use your hand here for support. You can even bring your hands behind your head and create a nice little lift right here to help lift that back part of your neck up into that stretch. For our next exercise, we're going to be doing a muscle release, and we're going to do this by placing our fingers on the back of our neck, and we're going to do it high on the back of our neck. As we look up, we're going to come down and drag the fingers down the back of the neck as we're looking down. So I'm going to show you an example of what that looks like. You're going to bring your hands down at the base of the skull, look up, and as you look down, these fingers will gently drag down towards the base of the neck. So base of the skull, looking up, and drag down as you shift your gaze downwards. So nice and gentle. It should feel really nice, like you're releasing the muscles here at your neck. We're going to do the same muscle release, but for the side. So the fingers come back to the base of the skull, lifting on either side of the neck here. And then this time we're going to rotate our gaze to the side, and you're going to feel this finger glide across the neck sideways. So lifting the gaze, fingers at the base of the skull, rotate the gaze over your shoulder, fingers drag across the sides. Here's what it looks like from the back. Fingers at the base of the skull, looking up. And as I rotate my gaze over the shoulder, you see the fingers glide across the side of the neck. It feels really good when you do it right. Feel some muscle release, some tension release, and don't forget to do the other side too. For our last exercise, we want to get a small towel and bring it to a nice roll. This roll should fit at the base of your skull, top of your neck, to give it a little bit of support. And then you want to come to a nice flat surface where we're going to take the roll and place it right under the base of our skull. Now, make sure your hair is positioned in a way that it's not getting hit by that towel, and you can rest your neck really nicely there, and the towel provides a little bit of support right there at the top of the cervical. So we're going to take the time to inhale and strengthen our neck by pulling the chin in as we exhale. And as we maintain our chin pulling in, we're going to rotate, applying that same amount of pressure, and you're going to feel the flexion of the neck move from the back of it towards the back side. And then I also like to exhale here, bringing the next inhale to center, just relaxing the neck. Feel free to readjust if you need to. And let's go ahead and inhale again. And as we exhale, bring the chin in and rotate to the other side. Maintaining that same pressure, nice and even. And as we inhale, relax and come back to center. Let's do it one more time. Inhale nice and big. Exhale, chin to chest. Rotate the neck. Nice even pressure. And as you inhale, come back to center, starting position. Exhale, chin to chest, rotate to the other side. Very nice. Next inhale brings you to center, and you're welcome to work into 3 to 5 repetitions of this on either side. Feel it out. You can work up to more repetitions and try it every other day or so. With these simple exercises, be sure to specifically target the responsible suboccipital muscles. Apply enough pressure for relief, but not too much that it causes pain. If you experience any numbness, tingling, or pain that radiates down into the shoulder and arm, stop the exercises immediately and see your doctor for further evaluation.